Okay. Uh, I'm going to explain about the pathway of the facial nerve. Now, the pathway of the facial nerve is very complex. Facial nerve have three nuclei basically. First is the motor nucleus, the second is the sensory nucleus, and the third is the parasympathetic nucleus. First, I will go through the parasympathetic nucleus. Now, the parasympathetic nucleus of the facial nerve is the superior salivary nucleus. The superior salivary nucleus is present in the pontomedullary junction, or you can say above the medulla. Now, first I would like to say that this is the midbrain, this is the pons, and this is medulla. Okay. Now, the superior salivatory nucleus, and the lacrimal nucleus give its fibers, which goes along the other fibers, which I would like to discuss later. These fibers go out in the pontomedullary junction like this and enter the internal acoustic meatus. Now this tube, or you can say this canal, is known as the internal acoustic meatus. As it passes through the internal acoustic meatus like this, it gives off two branches. One branch goes to the pterygopalatine ganglion, and the other goes to the submandibular ganglion and the submandibular ganglion. Now, the first branch goes up like this. This branch is known as the greater petrosal nerve. Greater petrosal nerve. This branch goes up like this, and in the middle cranial fossa, here the middle cranial fossa is the anterior cranial fossa, and here somewhere the posterior cranial fossa. This branch comes here from the foramen. This branch comes from the foramen lacerum, you can say, the foramen lacerum, and then this branch goes to the like this into the pterygopalatine ganglion, pterygoid canal, and then somewhere here is the pterygopalatine ganglion behind the maxilla. This is maxilla. This is the pterygopalatine ganglion. Happy. Okay. During its journey, it is also accompanied by the deep petrosal nerve. Deep petrosal nerve carries the sympathetic fibers, but it transverses the pterygopalatine ganglion. However, the parasympathetic ganglion gives its preganglionic parasympathetic fibers to the pterygopalatine ganglion, and then these fibers goes to the goes towards the orbit. This is the orbit. These post ganglionic parasympathetic fibers goes to the through the maxillary nerve, zygomaticotemporal nerve, maxillary nerve, and through the lacrimal nerve towards the lacrimal gland. Now the other branch, this is now the greater petrosal nerve. Now the main branch goes to the facial canal. Now this is the facial canal on the superior, and then we have medial, and then to the posterior of the, this is basically the medial wall of the ear, inner ear, middle ear. So it goes through the facial canal, and then it enters here, and then it goes to here, where somewhere submandibular ganglion is present. This submandibular ganglion then gives off its postganglionic branches to the submandibular gland and the sublingual gland. Okay, now I would like to discuss about the other fibers. Now I'm talking about the motor fibers of the facial nerve. The facial nerve, this is the nucleus present in the pontomedullary junction. It winds around the sixth nerve. This is the sixth nerve, sixth nucleus basically. It winds around the sixth nucleus, forming a facial collicular seen on the posterior surface of the pons as an elevation. Then this nerve moves along the parasympathetic fiber in the internal acoustic meter. In the internal, I would like to mention that in internal acoustic meters, there are also fibers of the vestibular nerve, which I would not like to discuss now. However, this moves like this motor nerve, and it all goes through the facial canal and then into the stylomastoid foramen, which is this, and afterwards it goes to the parotid gland, and in the parotid gland, which is present below the ear, above the mandible, angle of the mandible, and then it gives off its five terminal branches, which are the zygomatic or temporal, and the buccal, and the temporal, zygomatic or temporal, buccal, and the mental nerves, and the cervical nerve. That's terminal, five terminal branches, which is not worth mentioning here now. So this is basically the small motor nerve fiber. Now the sensory fiber of the um facial nerve, its pathway is like this. This is the nucleus of the tractus solitarius, which gets informed of the taste fibers. Now the facial nerve uh, and its branch, the chorda tympani, has its function of carrying the taste fibers from the anterior two-thirds of the tongue. This is the tongue. Now I would like to discuss about its pathway. Uh, if we go like this, the taste fibers, now this fiber should be discussed like this, that the fibers originating from the tongue and goes from this, but I would like to discuss in this. This is the nucleus tractus solitarius. Fibers go through it, the internal acoustic meatus, along other fibers, and then here, before going into the facial canal, it forms a ganglion, these taste fibers. This ganglion name is the geniculate ganglion. This geniculate ganglion gives its fibers, postganglionic fibers, that goes to the facial canal, and then like this. Now this should be remembered that this chorda tympani passes through the middle ear, like the parasympathetic fiber. These two fibers go. This basically is the medial wall of the middle ear. Now these two fibers go through the, or transverse, or go through the middle ear, and then the chorda tympani joins the lingual nerve, which is coming from here. Foramen where the lingual nerve is a branch of the trigeminal nerve. It goes to the lingual nerve, and then it goes below the tongue, and here it supplies the taste fibers from the anterior two-third of the tongue. Now I would like to discuss in this way. The anterior two-third taste fibers goes to the chorda tympani nerve, which goes to the lingual nerve, or you can say, and then into the chorda tympani nerve goes to the middle ear, then to the facial canal, and then back to internal acoustic meter, and give its supply to the this nucleus tractus solitarius. This is the basic and the simplest pathway of the facial nerve. Something I missed here: the tragopalatine not only gives branches to the lacrimal gland, it also gives branches to the nasal glands, nasal mucus gland, and the palatine glands. So this is my first video. I hope you will like it. Please like or comment if there are any mistakes, and I'm sorry if I made some mistakes.